Shall we start now?
Yeah, definitely, sir. Sure.
So, this is our lovely patient who underwent breast reduction with us a few months ago, and she has very nicely agreed to take part in this interview so that we can ask her about her experience. And this can help all our other patients because it's always nice to hear from someone who has undergone the procedure rather than just hearing it from the doctor. So, first of all, thank you so much for doing this.
Hello, everyone. Thank you, sir. Thank you for this amazing opportunity. So, yeah. First things first, I would like to thank Dr. Aniketh, sir. He's been very amazing. He's been very wonderful. I mean, the whole process, the whole journey was very smooth. Was very I didn't even know that I went through that surgery. So it was very smooth. And so, to talk about my experiences, first things first, every girl has this issue where, the breasts are huge and then she has this lot of less confidence and stuff like that. You will have all those this inferiority complexes.
Mhm.
But then once you go through this, you will have a lot more confidence. You feel so much more confident. I mean, that I don't have any words to describe it.
Thank
That
you so much.
happy I am right now.
You're,
It's
you're,
it's
you're.
not just me, my parents, my whole family is happy for me. So the whole process has been amazing. I would like to thank Dr. Aniket and his the staff who has worked with him and with us. I mean, it's been an amazing journey. That's about it. So first point was I got the contact through my sister
Mhm.
with Dr. Aniket sir,
Now,
and then
before that, if you don't mind, when did you first start feeling like you might want to undergo a breast reduction? What made you think of that?
sir, it's been actually like I was thinking like some 4 years back I wanted to go through because I was always been this kid who was very thin and then who put on a lot of weight
Mhm.
and then naturally my breasts also got
Mhm.
larger.
Mhm.
And then after some point of time, it started having so and so, and then it started sucking down. Even
Mhm.
after cutting down the weight, my breast didn't do much.
Mhm.
It did not reduce for me.
Mhm.
So
So, what
it's
were
not
you having any
that it's
symptoms?
working.
Any
I can't
were you having any
say
neck pain, back pain, any symptoms like that?
definitely. I have a lot of back pain. I
Mhm.
have a lot of shoulder pain.
Mhm.
I couldn't run. I couldn't do any sort of HIIT exercises where others were easily doing only because of these heavy breasts.
Mhm.
So like I was so inferior to them, like standing next to them doing those workouts.
Mhm.
It was like okay, that time I decided it was high time that I should go through this.
Mhm.
But then I didn't have enough time, and then so many other things happened. And then
Mhm.
I mean, if you're going through, just go through it one go.
Mm.
Trust me, that would help. That
Yeah.
will be like more helpful for you.
Yeah. And
And then
what?
especially during periods,
Mhm.
you will have a lot of pain there. I
Mm.
mean, you feel like as though you're carrying some 100 kgs.
Mhm.
That kind of
Yeah.
pain, I mean, that
Yeah.
feeling is too heavy for me,
Yeah.
for my body at least.
Yeah. So, were you having any other social issues as well? Were you able to find clothes that you wanted to wear? Were you able to wear what you wanted?
No, I always had this thing. So everything used to fit except for this upper part.
Mm.
So like, oh my god, how much should I even cut down weight?
Mm.
If it's
Mm.
not gonna work out anymore. Even if I cut down a lot of weight, if my breasts are not gonna be the apt size, it's not gonna work out for me. So I always used, I mean, like my friends used to wear such nice dresses, and then I'm like, oh my god, why should I do this?
Mm.
So that has always been there. Like I always had that inferiority complex.
Yeah. Yeah. So now, what kind of research did you do before this surgery? Like, where all did you see? What all did you look for?
Only I did all I did was
Mm.
Google a
Mm.
lot.
Mm.
And then since my sister was a doctor, she got to know you through her friends and then when was doing MCH and all.
Mm.
So that's all contact.
Mm.
But I did a lot of Googling and then Google never gives you right
Yeah.
answer. It is always better to consult your doctor first and then
Yeah.
take the right decisions.
Yeah.
It may not whatever you read in Google may not be the correct apt part because everybody has their own experiences.
Absolutely. Now, obviously, anyone who's undergoing a surgery will have some tension, will have some anxiety about it. Can you tell some of the things that you were a little worried about, that you were a little apprehensive about?
So honestly speaking, I didn't have any worries because
Mm.
I was too excited. I was too happy. There is little bit of
Mm.
anxietiness, but
Mm.
everybody will have that if they're going through
Mm.
surgery. But I, from what I got to know, that you were an amazing surgeon, that you were into this field for a long time. So I kept all my trust in you. Honestly speaking, I am not like exaggerating this, because the one that gave you, the one that we got the contact through, that person was a good friend of my sister, and then she was like, he's the best in this industry. So that's how like I kept all my trust in you, sir. Like I I mean, I maybe like 10% of anxiousness that has always be there. And then I was very happy.
Oh, that is so nice of you. Now, the surgery itself, what was it like? Can you just take us through it the day before and on the day? How did it go?
So what happened was, I had to meet sir for like 2 days prior, I guess, for the markings and all. So sir will make some markings. So that will be for his understanding and our understanding how the surgery is going to be. He'll explain to you everything carefully, clearly, so that you will have no doubts and everything like that. And after that, prior to the surgery, you have to like fast for like maximum 8 hours, maybe. Yeah. So you have to fast, and then the very next day you'll have your surgery, and then it was like all correct to the timings and all. So that's about it. I had to fast for 8 hours, and then
Did you feel
surgery.
anything at
I
all
didn't even
during
know
the
I
surgery?
did the and then it just happened. Like I was unconscious. After the surgery, you will have a lot of pain for like 2 or 3 days. That is because you're going through a surgery.
Yeah.
But it's not like it is not bearable and all. You can bear the pain for 3-4 days maximum, and then I was back to my working life. I was working from home, and then it was all fine. You have to have those frequent visitations with sir, so that he knows and we know what is going on. So that's about it. When did you start working again? When did you start working from home? When did you start going to work? So working from home, it's been a year already since we are working from home. So we've been working from home. So I took 3 to 4 proper days of rest. So that's about it. I mean, food wise, I didn't eat anything spicy. I mean, sir didn't say anything, but I myself didn't eat anything spicy. Oh, so that's it. Like you can sit, you can do all the work, but it's just that 3 to 4 days you will have some kind of pain. Yeah. I mean, some you will have pain, but it is bearable. It's not like it's not. I mean, it's too much and all. Yeah. It is bearable. And when you first saw your result, when we took the bandages off, what was that moment like? How did you feel? That was the best moment of my life. Trust me, this is the best decisions that I've ever made. I was so ecstatic. I'm like, only that person knows how they are feeling. Yeah. Because the person who's been through a lot because of that issue particularly, who has got less confidence issues in life, and then now she's like she's got the wings that she wants to fly with. Wow. So that was the best. That's such a nice thing to hear. Now, a lot of people who are thinking of the surgery, they're worried about that scar, that mark that comes below the nipple on the breast. What do you feel about that? Is that something that's really bothering you, or personal opinion? I think I didn't have much of a scar. I mean, you've done an amazing job. So even for the scarrings, they can undergo scar treatment. That's what you were suggesting me. And personally, I don't mind the scarrings and all. It is fine. I mean, it's not too much of scarrings and all. It is very fine. You can always undergo scar treatment after that. But what
so
you're
you
saying
don't have
is about scarrings and all those things, because that will be again taken care of. That is not an issue. But going through that amazing feeling once you get after the surgery is the best. So what you're saying is that the new shape and size is worth that one small scar, which is not that noticeable. Definitely, it is so much more worth than that. Like if I get hundred scores also, it's fine. I don't mind. I would want to get rid of that heavy weight. Absolutely. Me down. And then actually post op, I don't have much of back pain. I don't have much of neck pain. And recently when I had my like periods, I didn't have, like that heaviness that I was feeling inside me. So I was so happy. Oh my God, thanks. It was a good change. That was a good change. You already answered my next question. My next question was going to be, how has this changed your life? You already answered it. Yes, yes. And like while you're working, you don't have a lot of back pain, you don't have a lot of neck pain, you don't have to, when you're like when you're in periods, you don't have to worry, oh my God, your breast is like sagging you down. Nothing like that. You will be very happy actually. And do you have any message for anyone who's thinking of undergoing this, but they're a little bit unsure of it? What would you say to them? So, what I would like to say you is, please go through the surgery. you just have to have faith in the doctors. They know what they're doing. You don't have to worry about it. All you have to do is follow what doctor says, what follow what sir says, and then take care of yourself. That's all. I mean, you just have to go it in one mind. You don't think twice about it because they're the best in this field. Because sir has done an amazing job. Even I read through so many, like I went through his profile and all. He has been an amazing person. So whenever you have doubts, whatever doubts you have, you can always get in contact with sir or Kavya or anybody. They'll help you out all the time, anytime. So if you're going through, just go through it. It is definitely worth it. It'll change your lifestyle so much so that I don't have any words to explain because the minute that I look at myself in the mirror, I feel so happy. That's what a person needs. That the confidence that you get from this, it is more important. So I would suggest you go through this at one shot. Don't think
Absolutely.
twice. It will definitely be worth it.
Absolutely. Well, if nothing else, you have made my day. I'm feeling so much nicer talking to you now. And thank you so much for doing this. Because, like I said, I mean, I always feel like uh, when I'm talking to a patient, no matter what I tell them, they would rather hear it from someone who's gone through it. That's a different experience. It's a different this thing. And also, being a man, there's certain issues which I will never fully comprehend. I can empathize, but I cannot like fully get it. Because there's no way that I can go through it. So that's one reason I wanted to have this interview so that others can listen to you, listen to your experience, and hopefully impact them in a positive way. Thank you so much.
So you made me and my family happy. My mom's very happy. My sister's very happy. My dad's happy. I am more than happy. So you've been an amazing person. You've been like the transition is so good, so nice. So thank you very much for this opportunity, sir.
Thank you so much. Thank you so much.
Thank you, sir. Bye.